less than 1% of the general population has been diagnosed with dissociative disorders. To put this in perspective, just about 70 million people have been diagnosed with some sort of dissociative disorder, but even more have been undiagnosed.
How can you tell whether you or someone you know has dissociative disorder? Some easy ways to figure it out are to see whether you or a loved one ever experienced significant memory loss, including important personal information, loss of control over self, a need to flee, or gender identity crises. If you have witnessed some or all of these symptoms, then come see one of our certified psychologists and psychiatrists at whose clinic.
Types of dissociative disorder. Dissociative identity disorder. Two or more alter egos take over a dominant personality with subsequent memory loss. Personalities take years to switch. It does not happen in a matter of minutes. Dissociative fugue. A person feels a need to flee their current environment. When they flee, they tend to leave behind their past identity and memories. Dissociative amnesia, a characteristic describing people who forget memories without physical trauma. Depersonalization disorder, a disorder characterized by out-of-body experiences. The person suffers from no physical trauma. Dissociative disorder otherwise not specified. This includes trance and possession disorders. They are characterized by involuntary movements and the possession of singular alternative identities. If you have experienced any of these symptoms, come to Who's Clinic. We are your one-stop cure for any type of dissociative disorder. We have certified professionals who are willing to listen to you. We have 7 locations worldwide, including one on Antarctica. All of our locations are equipped with ways to help you relax. We offer yoga classes, therapeutic massages, meditation lessons, and a very calming view.
We want you to feel comfortable when talking to us, and that calls for relaxation. Once you are relaxed, we will try to understand your personal history and identify your problems.
Josh Murphy was a former patient of this facility in 2003. He was identified with symptoms of dissociative identity disorder by his wife, Susan, following the death of their daughter Maria in 2002 when he believed he was a woman named Jane Smith. A year later in 2003, after Susan had kept in contact with Jane via crocheting club, Jane had changed personalities again into a person named Kirk. Susan knew that her husband was not himself, so she called 188-FIND-YOU. While Josh was here, he underwent daily treatments for psychotherapy with hypnosis to help him regain his memory. He went to yoga classes and had daily massages as well to help him relax.
Kelly Coleman was a former patient of this facility in 2007. She heard of this place from a psychologist of hers after a close friend, Andrew, told her about the symptoms. Kelly had trouble recalling her past and was confused with who she was. According to her friend Andrew, Kelly had lived in Raleigh, North Carolina at one point, but after the death of her father, Bob, in 2005, she had become a completely different person. She went by the name Jennifer and had moved to Washington, D.C., leaving everything she had behind. Andrew, her fiancé, who she did not know anymore, was determined to keep in contact with her. He told her that he was a childhood friend of hers and her brother. In 2007, Andrew knew he had to do something about this. He asked his close friend, a psychologist named Ryan, to take a look at her. Ryan diagnosed her as having dissociative fugue and recommended she go to Who's Clinic. Dealing with heavy anxiety and depression, she was prescribed tranquilizers and antidepressants during treatment. Kelly was put into daily treatments of psychotherapy with hypnosis to help her regain her memory. After a full 2 years of therapy, Kelly is back to who she was before her traumatic experience and is married to Andrew in 2011. Don't forget, we're here for you.